Did you know that a simple medical diagnostic test can save your life? Many serious health conditions go undetected until it is too late, but regular medical checkups and medical laboratory tests play a crucial role in detecting these potential health problems early enough, give room for possible prevention and timely management. So, in today's video, we'll be discussing 10 essential medical diagnostic tests plus a bonus offer at the end that you should consider in order to stay healthy, be it heart disease, diabetes, renal or kidney disease, liver disease, or even cancer. With the right kind of test, you can discover these potential health problems early enough and take charge of your health. So ensure to stay through to the end because you don't want to miss a thing. Everyone, my name is Emily Nonye. Welcome to this channel where we discuss everything health and wellness tips with emphasis on reproductive and fertility health. So ensure you subscribe to this channel so that each time we upload a new video, we're going to carry you along. Trust me, you don't want to miss anything. So let's begin with general health screenings that everyone should do irrespective of your gender or your age. Let's start from simpler ones to the complex and even to the more complex procedures. So number one is blood pressure test. Probably you must have heard this over 1,000,000 times. Yes, that is because it is very important. Blood pressure test, otherwise known as test for hypertension, is a test that measures the force at which your blood pumps against the walls of your arteries. It measures the systolic blood pressure and your diastolic blood pressure. When you get your blood pressure reading, it has an upper number and a lower number. Example, 100/70. The top number is your systolic blood pressure, whereas the lower number is your diastolic blood pressure. Your systolic blood pressure is the pressure of your blood when your heart is pumping blood, whereas your diastolic blood pressure is the pressure of your blood when the heart is at rest between each beat. All right. So this test is very simple to take and it is not a painful test at all, and I don't even think it comes with any form of discomfort. How do you take this test? Usually the patient or the subject, you have to be at rest. If you're coming from a long walk, you need to take a seat, take some rest and be calm before your healthcare provider will allow you to take this test so that we don't get a falsely elevated blood pressure due to stress. Normal range is between 90/60 millimeter mercury and 120/80 millimeter mercury. Any value that is higher or lower than this is a deviation from normal and you need to speak with your doctor. There are certain conditions such as age that can make your high value seem normal. So that's why I'm saying anytime you get a value that is outside of this, is lower than 90/60 or higher than 120/80, you need to speak with your doctor so that he or she will tell you to relax or you need to get worried. And what does your blood pressure indicate? It tells you your overall cardiovascular health. All right, because uncontrolled hypertension can lead to both heart disease, it can even cause kidney problems and some other problems as well. So check your blood pressure today. Next up here is number 2, which is test for cholesterol. So many people think that this test becomes important maybe when you're older or probably if you're fat, but that's not true. Your lipid profile test ascertains the level of all the fats in your bloodstream, which includes the low density lipoprotein, which is the bad cholesterol, the high density lipoprotein, which is the good cholesterol that keeps your LDL in check, and also the triglyceride levels in your bloodstream in order to keep your cardiovascular health in check. So if you're up to 20 years or older, you need to take this test at least once every 4 years or more regularly if you're at increased risk of developing hypercholesteremia. So how is this test performed? Usually is a fasting test. Is done by drawing your blood from your vein, and you're required to fast If you've had your last meal of the day, probably by 7 or 8 p.m., you're not expected to eat any other thing until the morning of the next day, usually before 10 or 11 a.m. in the morning. You're not expected to eat any other thing until your healthcare provider have collected your blood sample for screening. All right, and it's a relatively very simple procedure. It's not going to cause you pains. You give out your sample for check. Do your cholesterol check today. Is very necessary to help you prevent so many heart diseases and other cardiovascular problems. If done and checked at the right time, if there's an impending problem on the way, you could find out and begin your treatment on time. So the next one is number 3, which is test for blood glucose, blood sugar. This is another simple test to take. It is very necessary for you to know your blood sugar levels. It's estimated that 1 out of every 3 adults have pre-diabetes, even without knowing it. WHO has estimated that 830 million people is living with diabetes worldwide. And how do you know if you have diabetes? It is when you run your blood sugar test. Usually this test is done maybe in your doctor's office or maybe by your nurse. That is the first line of test, which is called the random blood glucose levels. And if need be, if something is found, you will now be referred to the laboratory, where you now start with your fasting blood glucose test, which is another fasting test, because after your last meal of the day, you're not supposed to eat any other thing until your scientist must have drawn out your blood for tests. So there's no other way you will know if you have diabetes if you don't take a test, and it's a simple test, so why not? And is relatively not expensive to take, because uncontrolled diabetes or unmanaged diabetes can lead to so many problems, including kidney problems and heart problems as well. So do take your blood sugar level test today. You'll be definitely grateful to yourself you did. If you're still watching up to this moment, please just take a second and like this video, click on that subscribe button, and also share, so that anyone who is supposed to have access to this information gets to lay their hands on it. All right, so we're gradually moving into more serious and more personalized tests. So let's talk about the cancer screening test. You know, early detection is critical, and this test could save your life. It could save anyone's life. That is why there's need for you to do it on time. So the first line of test in this cancer screening test is called a mammogram. This is the test for screening of breast cancer. Apart from breast self-examination, if you're a lady and you're up to 40 years or older, it is time for you to get a mammogram. A mammogram is an X-ray or an imaging test that examines your breast to check for early signs of breast cancer, even before you get to feel any form of breast lump. And if you're up to 45 years and above, it is the right time for you to start your yearly mammogram test. It is very necessary. Nobody wants to have one breast or the other taken out. So number 5 here is cervical cancer screening test, otherwise known as pap smear test or test for HPV virus. HPV is a virus that is known to cause cervical cancer in women. All right, this test is usually done when a sample of your cervical secretion is taken from the os of the cervix and sent to the laboratory. It screens to check for abnormal cervical cells that could be found around that area. It is very important for you to take this test if you're up to 21 years and above, or if you're sexually active. It is important you take this test at least once every 3 to 5 years. This test right here with me is colonoscopy. This is a test that screens for colon cancer. It examines the inside of your large intestine, which includes your rectum, your colon, and the anus. All right, it checks the inside of the large intestine to diagnose for any form of bowel inflammatory disease or even colon cancer. If you're 45 years or older, your doctor will advise you to take a colonoscopy, or if you are statistically high level of developing colon cancer, your doctor will always recommend you take a colonoscopy, because this colon cancer, most times it doesn't present with symptoms or any form of warning before it becomes full-blown cancer. An alternative to this test is fecal occult blood test, which is done in the laboratory, but I recommend, or doctors recommend, colonoscopy because it can be diagnostic, it can equally be therapeutic at the same time, because as if there's a problem, if there's any polyps that is found anywhere in the large intestine, then it could also be removed at the same time, and it is equally a very sensitive procedure because it can be accurate in its diagnosis. Seventh test right here with me is prostate specific antigen test, PSA. This test screens for prostate cancer. All right, it checks for a particular protein in the blood that could be a marker for prostate cancer. If you're a man and you're up to 50 years or older, it is important you get tested for this PSA. And if you have a family history of prostate cancer, you endeavor to speak with your doctor so you know if it is important for you to do this test early enough. I mean, even before age 50. Let's now talk about the heart and the lungs. These two organs are very vital organs that are super important for the overall functioning of our bodies. And it's very important for us to monitor them regularly with tests such as ECG, that is electrocardiogram, pulmonary function test, that is your spirometry, and some other tests, so that you always be sure that they are in the right way they're supposed to be. Let's now talk about the kidney function test. This test evaluates how well your kidneys are removing waste products and excess water from your bloodstream. There are so many range of tests, which includes your urea, your creatinine, even the electrolytes, and even simple urinalysis. This urinalysis test has a way of telling you or giving you an idea of what is happening right inside your kidney. For example, I'm not supposed to be seeing protein in your urine, and you run a simple urinalysis test and I am seeing protein, I'm seeing calculize, I'm seeing cast, or even more serious things. It's going to tell me, it's going to raise my eyebrows. I mean, it is important for you to do simple urinalysis tests. It is the way of checking on giving you an idea of what is going right there in your kidney. So do one today, do it today. As you're listening to this, just take a simple urinalysis test. It can be as cheap or as cost effective as 500 or 1000 naira in local currency here. It is not expensive at all. So this brings us to liver function test. If you're an alcoholic, if you smoke, if you have had hepatitis, or you know you are into drugs, it is important for you to always do your liver function test so you stay ahead of this game. All right, this range of tests looks at your liver. You know, your liver, being the largest organ in the body, is responsible for detoxification and elimination of protein. So it is very necessary for you to always run your liver function test so you stay up your game. And lastly, eye examination test. You know, it is with your eyes that you see the world. I mean, you don't need to ignore it. When you assess other parts of your body, it's also very important for you to do your eye checks, to check for early, that way you're going to find out when early onset glaucoma begins to set in, cataracts, among other eye health issues. So as you're screening for other parts of your body, once in a while you meet an ophthalmologist, you meet your optometrist to assess your eyes. You assess your eyes, all right, so that you always stay up your game in these health tests, these health screenings I've mentioned right here. Please, hope you're already a subscriber in this channel, because if you're watching me up to this point, if you're watching me up to this moment, it means you like what we're discussing. It means you're interested in what this channel has to offer. Please help me subscribe. It's going to help us a lot to reach, so that this gospel, this good news, reaches a wider audience. All right, so I promised I was going to be giving a bonus offer at the end, and it's going to be the number 11th test, which is what? Your mental health. Depression can set the soul ablaze. There are various forms of depression, postpartum depression, and even other forms of depression. So always assess your mental health. When you think your head is full, you think you can no longer carry on, take some meditation. I have a video in this channel where I listed top habits, or I'll put the link to that video in the description box. I stated some healthy habits that could help you stay healthy and etc. All right, there I mentioned meditation. Meditation has a way of, is a food for your mental health. So anytime you think your head is full, take a deep breath, calm your nerves down. You can as well see your doctor. Your doctor is going to assess you with a number of questionnaires that will have a way of assessing your mental health. And if there's need for treatment, you're going to be getting prompt treatment and on time, because the key to, or the reason behind this video is early detection could save life. Early detection, remember, prevention is better than cure. Early detection could save you a lot, both financially, distress, and everything. So, to conclude, regular medical checkups and medical laboratory tests is the right way to dictate any underlying ailment or health condition on time and prevent them from progressing. So, you need to speak with your doctor to create a personalized checkup list for you, so that you're going to assess some of these tests, you're going to get some of these tests done and ensure that everything is working perfectly and everything is all right the way it's supposed to be. Everything is not malaria and typhoid. You feel unwell, and in this part of the world, you just get to the nearest drugstore and you're already consuming some malaria and typhoid medicines. And funnily enough, they seem to relieve you temporarily. All right, it is very necessary for you to put medical checkup in your routine. So speak with your doctor today and you'll be glad you did. Until I see you again in my next video, please don't forget to subscribe, like this video, and share to your friend. You'll be doing a whole lot for me and for everyone that needs this information. Thank you so much for watching, and I'll see you again.